Welcome back, everybody. This is Dr. Tom. I am a board certified physician in family medicine and in addiction medicine, and I have practiced for over 30 years in East Tennessee and Southwest Virginia. Today, we're going to talk about a somewhat controversial topic, but an interesting topic that a lot of people have asked me questions about. And the question is it safe for a woman to smoke marijuana during pregnancy? Is it safe for the baby? There's been a lot of research done in recent years, and it's indicating that there are probable and significant harmful effects to the baby if you smoke marijuana during pregnancy. So let's review this a little bit because what we're really talking about is the development of a human brain. Now, think about it. In between these two ears, there's 3.5 pounds of goo. And in that goo, there's 150 billion neurons, brain cells. That's more than the stars in the galaxy. And each one of those neurons is connected to 7 other neurons, and they talk to each other through synapses. There's over 1 trillion synapses in a human brain. And they talk to each other with chemicals. The chemicals are called neurotransmitters. Sometimes they're called neuropeptides. There's over 1,000 of them. And we've identified, or we understand a little bit about maybe 20 of them, like epinephrine, norepinephrine, serotonin, dopamine, endorphin. You've heard of some of these. There's also cannabinoid receptors in the human brain. So this human brain is incredibly complex. So just imagine inside of a mother's womb, you got a little baby. The baby is trying to develop and grow a human brain based on the genetics that it has. Well, anytime you add an additional chemical, it's going to affect the way that baby's brain develops. Like think about alcohol. Most women know not to drink during pregnancy, but sometimes it still happens. And the result is really tragic. It's called fetal alcohol syndrome. Those babies are born with permanent brain damage and permanently retarded. So you obviously don't drink during pregnancy. But what about smoking cigarettes? You smoke cigarettes during pregnancy, you have babies that are small, small for gestational age, they have small placentas, and they have their own set of problems. You talk about benzodiazepines like Xanax and Klonopin. If you take those during pregnancy, they can cause specific birth defects. There's nothing good about that. But what about smoking marijuana? Well, there's clearly identified cannabinoid receptors in a human brain. So the baby's trying to grow and develop their own cannabinoid system, and then the mother smokes THC or Delta 8 or Delta 9 or CBD and CBG, and those extra chemicals go directly through the placenta to the baby's brain. And so the baby's brain has all this extra THC and is trying to develop a system. It's obviously going to cause problems. So what did we find? There's 5 main problems for kids that are born from mothers who have smoked marijuana. Number 1, there's increased levels of anxiety and depression. Number 2, there's increased aggressiveness and delinquency. Number 3, there's clearly hyperactivity and attention deficit disorder and memory defects on kids where their mom smoked weed during pregnancy. This all seems to be tied in to the fact that there's increased levels of cortisol in these kids. And cortisol can make someone hyperactive, make someone aggressive. Cortisol is sort of the aggression drug. And finally, there's some evidence that if a mother smokes marijuana during pregnancy, that the kids have decreased immune systems and they're more likely to get infections. So clearly there's problems. And if you're pregnant or you're thinking about getting pregnant, you should probably try as quickly as possible to stop smoking marijuana. If you're a daily smoker and you just stop all at once, you're definitely going to go through THC withdrawal syndrome. And if you've done it before, you know it's not really pleasant. You're going to get jittery, anxious, nervous, sleepless. You won't want to eat anything. It's really an uncomfortable withdrawal syndrome, and it lasts at least 4 or 5 days. So I would recommend that you taper slowly, that you would figure out how much you're smoking and really start to decrease it over a course of 2 to 3 weeks. That would be a reasonable time frame. If you don't really smoke often, then just don't smoke when you're pregnant. In general, You don't take anything at all while you're pregnant without talking to the baby doctors. So that's the story. If you're thinking about getting pregnant or you're getting pregnant, you don't add extra chemicals to your brain. Thanks for joining us. This is Dr. Tom. If you like this content, please hit like, comment, subscribe, ring that bell, share, and check out the suggested videos if you would on the way out. Thanks again.